Hi, my name is Sabrina Marie Chase, and I'm here to talk to you a little bit about what to keep in mind when you are consulting with Latino patients. I'm going to try to give you a few important ideas and then some general background that I think might help. I'm a medical anthropologist by training, also an assistant professor at the Rutgers School of Nursing, and I work with a PhD Joint Urban Systems and Urban Studies. But the reason I'm here to talk to you about this is probably because of my dissertation work with HIV-positive Latinas in the greater Newark area. Things that are most important to keep in mind. Latinos are an incredibly diverse group. There are so many people from so many different countries and cultural backgrounds that are grouped under the general rubric Latino or Hispanic. The first thing I think to keep in mind is that there are no hard and fast rules. What works very well for one particular group may not work for another. For example, religion. Catholicism has been long a part of Latin culture, but increasingly in the last couple of decades, more and more Latinos are Pentecostal. And often they do not work the same way and do not have the same preferences. When you are trying to speak the language of the person that you're working with, it's important to remember that one piece of slang may mean one thing to one group of people and something completely different to another. So particularly when working with Latinos, it's important to keep in mind that you need to be extremely flexible. And you need to watch carefully to try to read body language and figure out what's working and what's not. If you can find a cultural broker, that would be optimal. And by cultural broker, I mean someone from the subculture in which you see many patients that you can work with, who can sit with you in working with patients or clients, who you can talk to learn more about the culture. And with Latinos, it's not enough to say work with a Puerto Rican cultural broker if in fact you're going to be treating people from Nicaragua or from Mexico. You need to be very specific and look for cultural brokers who are parts of the community that you work with the most and learn from them. That's probably the most important rule. It's important also to remember that one of the most common languages in the United States isn't actually Spanish, aside from English, it's Spanglish. So you will have many Latino patients who actually speak a little bit of Spanish, but maybe not as much as you would expect, and they may want to communicate in a mixture of both. There will be some Latino patients who don't speak Spanish at all and maybe feel a little bit odd about it. So really, when you're working with your Latino patients, you need to be very conscious of the incredibly broad spectrum out there, religiously, culturally, in terms of country, background. The diversity is so great that it's important to be very, very flexible and very, very careful. That given, there are some general things which help, but I believe that they would help with any cultural group you're working with. First of all, the concept of respect. In most Latin cultures, the idea of respect is very, very important. To treat each other in a way that is caring, loving, kind, to listen carefully, particularly if you're working with senior men in the household or senior women, you will want to treat them with with a circumspect attitude and with great respect. They will note this, they will care about this. In general, it's very common amongst many groups of Latinos to want to involve their family in many decisions. So if they want to bring family members with them to the consult or to the appointment, if it's at all possible for you to accommodate them, please do your best. It is also very possible that some of the people that you work with may have backgrounds using ethnomedicine or tea or herbs, and they may not feel comfortable speaking to you about this. If you can create an environment where they feel that it is safe to tell you about all their complementary and alternative medicine practices, that will probably make it easier for you to help them and collaborate with them. In general, the most important thing is to stay flexible, respectful, to listen very carefully, to allow them to speak, to make them feel as though not only do you care what they think, but it is as important to you as what you think. In general, I think these are the most important guidelines. Anything you can do to continually learn more about the culture of the people that you work with will improve your care and improve what you can do for them. So I encourage you to always seek to become more and more educated in the cultures from which your patients and clients come. So I think those are the most important factors. Thanks so much.